Dear all, this is Dr. Turki Algari from Prince Sultan Cardiac Center from Riyadh, Saudi Arabia. I'm going to talk about earlier ECMO, the earlier PrEP. I have no disclosure, and it's about cardiogenic shock and use of mechanical support devices are a matter of updating and ever-changing science nowadays, and thereafter I'm very pleased to present distinctions of easy, fast, and favorable outcome with a patient who came in cardiogenic shock, and to open a new window for revising and further confirmation in randomized studies. The case about 80 years old, so the male who was having a diabetes, hypertension, and dyslipidemia with a previous stroke presented to ER with shortness of breath class 2 to 3 and desaturation. His ECG showed a new left bundle branch block, and he developed thereafter a cardiogenic shock. He was intubated and was started in inotropes, and he was requiring mechanical support. That's why he was placed on VA ECMO. Initial labs show high troponin and high proBNP along with the normal creatinine, sodium potassium lactate was 4 and CRP of 70. This is his 4 apical chamber fuse with transesophageal echo pre and post ECMO, and he showed much improvement post polypneumonia ECMO at ER setting. This is his initial coronary angio, which showed a significant proximal segment lesion at the LAD along with the diffuse disease and stagnant flow. Starting with preparing the lesions and stent, and then stenting the vein as well. Here the flow is much better improved, and thereafter the flow is TME3 down to the transapical LAD. Here optimizing the stent, and this is another view which is much better than the initial one. After the intervention, the gentleman was shifted to CCU, and he was taken a couple of days and then showed unfavorable progress in his status since it was difficult to wean off from ECMO. So what was the next step? Put an impella or intra-aortic balloon pump. I plan to insert the intra-aortic balloon pump, and after 1 day we could start weaning him from an ECMO with a successful decannulation and having a favorable outcome. So the discussion about this case in patient with cardiogenic shock and multivessel disease, coronary artery disease requiring ECMO, PCI only for culprits, you may not be the fair way out from neither mechanical support nor circulatory shock. However, in such critical condition, patients are deemed high risk for CAP. I presented this patient with anterior wall 9 cardiogenic shock and difficulty in weaning from ECMO. Successful ECMO weaning was achieved after insertion of an intra-aortic balloon pump. While the long-term outcome benefit of intra-aortic balloon pump is still under debate, in some cases we may consider intra-aortic balloon pump insertion may have critical curve on patient's immediate survival. Patient went home on a very stable condition after 3 days from decannulation and from the ECMO. Thank you.